good afternoon and welcome to the teleconference session for the post-basic BSc nursing students of Indira Gandhi National Open University. We are going to have the session from 2:30 to 3:15 and we'll have a break from 3:15 to 3:30, resume back on at 3:30 and we are going to discuss majorly two blocks. One we'll be talking about your BNS 109 which deals with the community health nursing. That is basically, you know that the community health nursing is an area which encompasses all the areas which you have learnt in your first year and second year, and that's where you are going to practice in the community of what you have learned. In your block 1, we have got basically the principles and practice of community health nursing, whereas in block 2, we have the role of a nurse, community health nurse in specific societal problems. Also, role of nurse in national health program is dealt in block 3, whereas in block 4, we have community health nursing administration. Now, you have seen that we have gone from the basic concepts to the community health nursing administration, because as expected from you that you should be able to do the administration in the primary health center, in the CHC, in the district health centers as well as in the sub-centers. That's why block 4 is totally devoted to the community health nursing administration. Today we thought we'll start with the concepts, the basic concepts. So we'll talk about the principles and concepts of community health nursing. In the studio, immediately to my right, we have two very eminent community health nurse specialists in the country. Immediate right is Mrs. Santosh Mehta. She is she's in the field of community health nursing past, I think, 35 years, sorry. So I'm sure she will be able to share with you the practical experiences, and you, if have any question regarding the community health nursing, can get back to us in the studio. On my extreme right, I have Mrs. Patni, who holds a similar kind of experience and also rich in her knowledge and skills in the community health nursing. So don't miss the opportunity. You can ask many more concepts also which are not clear to you. With this, I will start requesting our speakers that when we talk about the community health nursing being a large area, how do you describe this concept of community health nursing? Mrs. Patni?
Yes, as Mrs. Kapoor has rightly said that this is one of the very wide area. Community health nursing, I would say, involves almost all the areas in nursing. We have to integrate all those whatever we have studied to implement that in community health nursing. Now, before we go to community health nursing, I think it is essential to know what community is,
yes,
what is community health, and what is community health nursing. Now, first we talk about community. Community is an area where we need to provide the services. You will find a difference between hospital care and the community care. Hospital care is a defined care in an institution where patients come to us, whereas community is the area where we go to the people and assess their needs and give the care accordingly. So this community where we are working, we need to know about that particular community, what it is, what are its health needs, what are the health problems, so that based on that we can plan our care and implement. Now, for a community health nurse, it is essential to know that how do we define community. A community is a group of people living together in a defined geographical area, sharing the same resources, the norms, the values, and social institution. So this we would say that a defined area, we name that particular community. Like, for example, a community who belong to a boundary, you can name any one of the community. That means those people belong to that particular community. Or you can say those people share the same resources. These resources may be educational resources, environmental resources, whatever other resources they share with each other. You must find the difference. A community is, they are the permanent residents of that area. Sometimes there are temporary people who are staying and then go away. That is not a community. Or if we talk about hostel we cannot say it's a community because students will come and go. But community is a permanent residence of that particular area, and there is a landmark that this community belongs to only this area. Like, for example, Lajpat Nagar area, that is one area defined as a community. or you can say as defense colony is one of the area which we can say that this defense colony is from this area to this area. Now why we need to know about this particular community and its boundary is because services will be defined to that particular area, because health needs, the health problems may be different from one community to another, and we must have our limits that where to what extent we have to give the services to the people.
Right, I think this is a very important concept to be clear what community is and what particular area do we call community. For example, Maidan Gadi community. It's the community of people living together with same values, same traditions, and are there in a defined geographical area. Then how do we describe community health, Mrs. Mehta?
Yes. Community health is health status of the members of the community. Like Mrs. Patni was just talking, that it comprises of people.
Yes.
So it is the members who are a part of that community, it is their health status. So major determinants of their health status are their disease pattern, their life expectancy, their health expectations of the people, and also what are their cultural, environmental influences which can have an impact on their health, and finally the health behavior. So community health is mainly to focus on the health status of the people who are living in that community in a defined geographical area, and it was also emphasized that it may be a permanent residence or they belong to that community. The transitory or migrating type of a population may be there for few days, but the health status of that community will be reflected by who are the members of that community.
I think this is very important. It's very nice that Mrs. Patni explained us what is a community and what is community health. Now, as community health nursing students, how would you define community health nursing for them? Mrs. Mehta? Sorry. Ms. Patni, you would like to add? Yes.
See, when we talk about community health is that we need to provide complete health to the people. That
Yes.
means we are responsible to see that all the members of the community are healthy. So in that case, we see what is their health status, what are their health needs and the problems. We identify those problems, and based on that we try to solve the problems. So as a community health, we need to provide health care to the people based on their health needs and health problems. Now earlier this name was as public health. Now it has been changed to a new concept as community health. Now community health's new concept is that people are responsible for their own health. That means they should know that what are their needs and how should they be able to take care of their own health. So in that case, we want to involve people in planning and in implementing the health needs and the health problems of the people. It also needs providing comprehensive health care. Comprehensive means we need to give complete health care, that is preventive, promotive, curative and rehabilitative. We should not only strict on to only preventive and promotive or to curative, but we have to consider all aspects of the health care. And it also needs physical, mental, social and spiritual. As WHO's definition, all we know, that means it is in considering all the dimensions of physical, mental, social and spiritual health. So a community health includes all these aspects and to provide health care to the people in the community.
So, Ms. Mehta, would you like to add now what is community
I
health
think
nursing
yes,
to what
thank
Mrs.
you,
Patni
madam.
said?
Community health nursing is a synthesis of body of knowledge of community health sciences and professional nursing practice or theories. The purpose is to improve the health status of the community. That is how we define community health nursing. I think I'll just like to emphasize on that it is community health sciences which is not anything much more than improving the health status of the community. It rotates around the health status of the people who are living in that community, and with the use of nursing theories and professional nursing knowledge which is with us. So I think we should not forget nursing, basic nursing or nursing practice which we learn in the institutional area to be applied to the community setting. So it is a combination or synthesis of body of knowledge of community health sciences and professional nursing practice and theories.
I think this is very important. Now, before we go to the next one, let me request all the regional directors to kindly give us the attendance. I understand in the morning hours the DNA students were sitting somewhere and they wanted to ask questions. They did not ask thinking that there will be open house. No, you can interrupt any time and ask the question, because these are interactive session. If you ask a question, we'll immediately reply. May I request the producer to kindly roll down the telephone numbers and fax number once more for the students, and request the regional directors to kindly facilitate them to ask the questions, because we had a DNA teleconference from 1 to 1:45, and after that we came to know the students wanted to ask the question and they thought there will be a session for the question answer. Please, you ask us question in between so that the experts can answer you then and there. Thank you so much. Now, there has been various trends in community health nursing. What are the latest trends which needs to be followed, which are existing in the community health nursing?
Yes.
Yeah, Mrs.
So when we
Patni?
talk about trends, of course, there are certain changing trends which are taking place in community health. Now, these trends will have impact on what type of care is required for the for community people. In that case, we need to know these various trends so that our care is based on these aspects, like chronic diseases and prolonged hospitalization. When there are advancing chronic diseases, like these diseases may be cancer, diabetes mellitus, or it can be tuberculosis, these types of diseases are prevalent in a particular community, will have impact on the type of care required for the people. Then problem of the aged. Now the life expectancy is increasing and the problem of the aged is increasing. So there is a demand that these type of people require more care. Now in that case, if we talk about problem of aged, we need to know about the demographic aspect of the population, that what type of population is existing, so that based on that we can assess our needs and the problems of that particular community and plan the care for them. Then population and explosion and the family. Now since the population is increasing very fast, because the growth rate is increasing at the growth rate of 2% per year. So you can imagine how much it will increase by in the coming years, and which needs to be taken care, and in spite of having family planning aspects. Then population, pollution, noise and radiation. Pollution is increasing. That can be air pollution, there can be water pollution, that can be noise pollution, radiation. It has relationship between the population and the pollution. Pollution is increasing because of the population, and this pollution has an impact on the health. So how do we control this pollution so that we can maintain the health of the community people? Because of increased industrialization and urbanization, there is a movement from rural to urban. So there is more dense population in the urban, creating problem towards health, and more of industries causing pollution in the community. Then drug addiction is again increasing. That's one of the societal problem, and moreover alcoholism is causing a problem for health. Then lack of health education. People are not much aware about certain aspects, how to take care of them. So needs good information, education and communication to the people through health education on various aspects, that how to have their healthy lifestyles. Then concept of sociology, psychology, anthropology and mental health is required to know for a community health nurse, that what is a society, what are the psychological aspect of a family or an individual, and all these knowledge is required for a community health nurse to work in a community. Then introduction and use of gobar gas plants, Anganwadi, vocational courses and use of media need to have some aspect relationship for the community health nurse. Vital statistics are important to know, because whether these rates are increasing, morbidity is increasing or it is decreasing. If it is increasing, why it is increasing, so that we can have some good care to the people, so that infant mortality rate or MMR can be reduced. Then adulteration of drug and food has impact on health, which we need to have some control over the adulteration. So these are some of the trends we need to take care in providing community health nursing care.
I think this is a big challenge for the community health nurses working in the field, because there is so much of demographic change, epidemiological changes, that the community health nurse needs to put in a lot of efforts to see that all kind of assessment is done to see that the community health is maintained. So there would be a specific characteristic of community health nursing.
Yes.
Now just thinking that every nurse can go and work would be one of the factors, but I think that every nurse needs to be prepared in community health nursing field in a more intensive manner to take away the expanded role.
Yes.
Because now it is extended and expanded role of community health nurse or a nurse working in the community. So Mrs. Mehta, what do you think could be some of the characteristics of a community health nursing?
Thank you. I think Mrs. Patni has rightly introduced that it was disease pattern, and now we have reached to a stage where it is the psychology and sociological aspects also we have to consider in community health. So when we talk of characteristics of community health nursing, one is that it is a field of nursing. It is nothing much different. It is what nursing practice, professional nursing practice you have, it relates to community health nursing. Then it is a combination of public health and nursing practice. As in the definition also, I try to emphasize that it is a community health science and nursing theories or nursing practice. It is a combination. Then it is population oriented. Mrs. Patni has also emphasized that demographic concepts or demographic idea has to be there when we are talking of community health nursing practice, because it is people oriented. The clients are the people or the population. The community comprises of people, so it is a population oriented. The central mission is to consider the total population or the population which is in the vulnerable groups. Then it emphasizes health. The community health itself emphasizes on preventive, promotive, and of course without curative the services are incomplete, but the emphasis is there on preventive and promotive. It also emphasizes an optimum health and positive health. We are not only to look into the disease cure, or we are not only aiming at disease to occur and then we will take care. We want to prevent and promote health so that there is positive health or optimum health. In the natural history of disease also, we don't want to wait for pathogenesis and post-pathogenesis. We are aiming at pre-pathogenesis where we can prevent the disease. Then it also aims at involving people, participation of people in their health, and also involvement of interdisciplinary sector or interdisciplinary team members to look into the community health services which are to be provided, and nurses are going to be a part of the health team to work where it will be involvement of other sectors and nursing, and that will be a comprehensive community health services. That is what I think we can include in the characteristics of
I think these
community
are very
health.
specific to
Yes.
community health, because it's not like in a hospital. You have the interdepartmental approach, but there is definitely a need of interdisciplinary, sectorial approach, so that multi-sectorial approach, so that the community gets the best of advantages for the health care. When we conceptualize the community health nursing practice, what would be in your mind, Mrs. Patni, that how the community health nursing practice can be conceptualized in a framework sort of a thing?
Yes, I think before we provide community health nursing practice or before we give community health nursing care, we can have some concepts to be clear that how to provide the community health nursing care to the people, and put in some framework that how can we have a systematic way of giving care to the people. So in that case we need to have the practice in prioritizing, that we have to give all types of preventive, promotive and protective care to the people. Now preventive may be most priority because prevention is better than cure. So we need to give that emphasis on that how do we prevent the care, how we prevent the diseases, maybe by purifying the water or good environmental sanitation, or by giving immunization will help in giving preventive and promotive aspect of the care. Then intervention through educating them, engineering and enforcement. Education is that we want to make the people self-reliant just by giving education so that they understand how they have to have healthy practices in taking care of themselves. Engineering is that we have to put some work into action, that we can do something for them so that their environment is healthy, and enforcing them that they should adopt those practices which we want them to adopt. Now, for example, we want the people who are in rural areas that they should, instead of open field defecation, they must use sanitary latrines. In that case, we have to enforce them that why they should go for sanitary latrines, what are their advantages, and what are the health hazards if they have open field defecation. Then scope for individual to community. That means community health has a wider scope. There is no end we can say that where do we end this subject, because this keeps on, the scope is expanding so much, as Mrs. Kapoor has rightly said, that our role is also expanded along with the scope of community health nursing. So that can start from giving care to the individual, to the family, and then to the community. There are certain factors which are designed when we give care in the community. These factors we need to keep in mind, which are factors affecting the health. Now, these factors are socioeconomic status. Of course, it has impact on health. A person who is good economically can have better health. Then hereditary is one of the factor. Environment is the factor. Then there are health services available and health services provided to the people. If it is easily provided, people will go for the care. And if in case the distance is there for providing health care, like rural people, they are not able to afford to go to big hospitals, so they have lack of services. Then dynamics, it has two processes, that is the process of nursing and the process of values. That means when we give care, we have to keep in mind that what are those steps which we follow in giving care and giving value to the other individuals, and they should also value to the care which we give to the people. So these are some of the conceptual frameworks which are for community health nursing practice.
I think this is quite detailed out, and you have seen a slide also that what could be the scope of community health nursing working in various settings, which Mrs. Patni was mentioning. We are talking about the community. How do we do the community identification? I mean, what are the ways by which we say that this is a community, these are their needs, and this is the plan we need to carry on? So, Mrs. Mehta, would you like to highlight what processes or how do we talk about community identification?
Yes, thank you. I think community identification is knowing and exploring the community in depth. From the beginning, we have been talking of knowing community. So here we are going to discuss in community identification, how do we know about the community? Because our future actions, community health nursing actions, are going to depend on what is our community diagnosis. So community identification helps us in community diagnosing. When we want to collect information about community, we have to systematically know about community. We have to step by step find out about community. As a community health nurse, we may have various sources of information for identifying community. It may be survey, it may be going through records and reports, it may be interviewing other personnel working in the community. Of course, as I had already talked of interdisciplinary approach, we may have other team members through whom we may get the information. So it is the demographic information about the community, the geographical information about the community, the cultural pattern, the group dynamics, the socio-economic pattern, all these informations which will help us to know about the community in depth. I think one by one, if we look at each point, the geographical features will concentrate on what are the landmarks of the community, what is the area coverage, what is the type of climatic conditions in that community, in that area, or what are the main boundaries, the type of housing, physical features, all that these may be a type of geographical information which we may like to collect. Demographic information will be age and sex distribution, the type of people living, occupation, their main interest areas, all which relates to people will be demographic information. Then cultural patterns, values, beliefs will be all aspects of their people living in that community. Then when we come to group dynamics, which will also help us to know their channel of communication, how do they interact with each other, how as a community health nurse we can also pass our messages to the community, because once we are aware of what are the channels of communication, is it telephonic, is it verbal, it is through religious organization or through panchayat or mahila mandals, what are the ways we can reach to the community. So all these informations when we have, it will help us to diagnose the community. What are the issues and problems? It may not be always in the form of problems, it may be in the forms of issues in the community. Like for example, if there is a adolescent health problems, maybe they are not sick, but there may be other issues which may relate to care of adolescent girls or boys. So community diagnosis will help us to say what are the challenges for us in the community, which may help us also to establish priorities and then also to plan a nursing action or community health nursing action, and then implement the community health nursing action and evaluate what actions we have planned or implemented in the community. So in nutshell we should say that community identification is the first step for any community health nursing actions.
So I think this is very interesting that we need to really see that the community diagnosis is made or community assessment is done, leading to community action and then evaluation of the actions which we are taken, which the community health nurse has taken. But I think every care which is to be provided, like what you were talking about, community diagnosis and leading into action, goes through a process.
Yes.
And that's where we talk about community health nursing process. So what do we mean by community health nursing process? I think Mrs. Patni, would you like to elaborate? What is community
Yes.
health nursing process?
Now I think nursing process has been one of the new concept or important concept in any care in the nursing care. So we need to know what is nursing process. When we talk about process, it is a continued action of a nurse to provide care either to a client or to a patient or anywhere. So nursing process is based on the art and science of the nurse which she gives care to client. Now community health nursing process is the process which provides care to the people in the community. Now these are the series of steps to deal with the health needs and the health problems and to solve those problems in the community. So when we talk about a systematic care of giving care to the people, then we say that there are certain steps which are followed. So these steps have to be taken care when we talk about process. Otherwise we sometimes these can be interchanged, but otherwise when we start planning our care, it has to be like this. Now there are certain characteristics of community health nursing process, that is, it is equivalent to problem solving. Now what is problem solving? This is also based on series of steps when we have a problem and solve systematically. So community health nursing process, we can say, is an aspect of problem solving, and it is also management which includes analysis, decision making and problem solving. It is also a change process. That means when we have community health nursing process, by evaluating we ensure that some change has taken place in the community when we give the care. There are certain steps which we need to follow in community health nursing process, that is establishing and maintaining working relationship. Now the first step foremost is that we must have good interpersonal relationship in the community. Sometimes it happens that community health nurse is not able to approach to the community properly, and people are not accepting the person or they do not listen to her. In that case we may have problem, because we need to find the factual information from the people before we give the care to them. Otherwise our care may have some it may not be what actually we want to give it to the people. So working relationship is that when we are going to the community, we are having informal meeting does not mean that we can talk or do whatever we want. We must maintain our professional relationship. That means we should not disclose our own personal things or should not involve too much in their personal things, but should be able to collect the information whatever we want to collect. So have its own working relationship with the people when we are working in the family. Then assessment of health and nursing situation. So when we go to the family, as Mrs. Mehta has rightly said, that we need to know, explore the community. How do we do that? That means we have certain ways and means of exploring the community, maybe through observations. That means when we go to the people, we need to observe their environmental conditions where they are living, or their lifestyle, how they are maintaining the healthy lifestyle, or they are having some wrong practices. And also we need to go through certain records to know about the family and their health problems. And talking to them, or questionnaire. We can have some questionnaires, some interview schedules where we can find out the facts, and based on those facts we can plan our care. So assessing the health need is based on the data which we collect from the family and nursing situations. Now health is different and nursing is different. There are certain aspects which we can take care. So which are those nursing situations where we can take care of that particular family? And establishing the goal for health and nursing care. When we talk about nursing situations, we can say that this is supplementary, developmental and intervention. Supplementary is that we need to give direct care to the person. That means we are giving care which people are not able to take themselves. Like for example, a person who needs injection and is not able to go for taking injection, maybe we need to give the care to the person and give injection. Then intervention, the developmental is that we develop the people to take care of themselves. Like for example, teaching them that how they should be self-reliant when we are not there in that place. So in that case we have to see those situations, that where can we give care, where can we facilitate the care. Facilitate in sense that a community health nurse may not be able to go daily, but at least she can engage somebody, teach the person, and that person can give care instead of community health nurse. And these situations will help us in establishing our goals. Goals and objectives are essential because we cannot give the whole care at one time. So in that case we need to prioritize our care and we need to set our objectives. These goals and objectives may be short term and the long term. Short terms are based that which are immediate, requires action. Immediately a child is having diarrhea, we need to take immediate action, that how the child should be prevented from dehydration. So we can give ORS therapy, and this is a short-term goal. Long-term is that after the child is completely alright, we need to have preventive and promotive care of the child. So in that case we need to send the child for immunization or good nutrition or other aspects of the child care. So in that case one has to set the goals, that which are those goals which are within our limits we can give the care, and where we can refer. In case some things a nurse cannot do, she can refer those cases. So this can also be one of the goal if this is not within our limits. Then constructing and implementing a program of action. Based on the goals will give us the direction that what type of action do we have to take. So these objectives will guide us that what care is required to this family based on its needs. Now the health need may be poor environmental hygiene, it may be poor child care, it may be family planning, it may be nutrition care. So we have to plan our action that what this family requires to give health education. So we can give health education to the people for which they have knowledge deficit, and then evaluate the action. Sometimes we give the knowledge, we give health education, but still we are not sure whether the people have followed or not. So in that case feedback is essential, and we need to ensure that are we able to achieve our objectives or not. So the set objectives, then we compare with what people they have accepted or they have adopted or have they understood, we ensure by evaluating the action. So that can be by questionnaire, by observation, by return demonstrations, or by asking them question and doing follow-up. We do the evaluation, and if still they have not understand, as I said, this is a process, it is continue. So after evaluation, it is not the last step, but we again restart with, if they have not understood or if we have not able to achieve our objectives, then where is something is wrong? Is it that something wrong with collection of information or in planning or in setting the goals? So again we go back and come back to the same steps and ensure that we are able to achieve our objectives.
I think if we take you back to your first year, you have done your course on Nursing Foundation, BNS 101 and BNSL 101. And during that course, you have learned about nursing process. You have also seen that the nursing process is applied in all the areas, may it be medical, surgical, mental health, pediatric nursing, maternal nursing, so is with the community health nursing. The steps may remain the same, but the approach varies, because in community you do not have a defined ward, defined bed for the patient. Here you have a community, you have people living together, and that's where you will have to see that how you can do the mapping of the resources and what all the action you need to take and evaluate. And it is a vicious circle that you may have to redefine your objectives or redefine your action. As Mrs. Patni said, it is a continuous process. Now before we talk about the principles of community health nursing, I would request the regional directors, if students are sitting there, please ask them to let us know if they have any question, or please give us their attendance. Delhi, I understand some students are there. Karnal, Kochi, Khanna, Hyderabad, Bangalore, Pune, Behrampur. Any student sitting anywhere, please let us know how many students are attending today's teleconference. Even the students are not there, please let us know that students are not attending today's teleconference. At least we can see that what can be done for the future. So I would request you to give us a call at the studio. If you do not get our phone, you can kindly fax it to us. Thank you. Now before we wind up this session, it's important to know what are some of the principles of community health nursing.
Yes.
Mrs. Mehta?
The principles of community health nursing practice are something more than the nursing principles. Okay. So we have to keep in mind the principles of nursing, and in addition to that we should keep in mind the principles of community health nursing. The first, as we have discussed to some extent, that we should know our community thoroughly. We should know in depth about the community. It may be through the community, through other members of the team, which we have already discussed. So once we have the knowledge about the community, then we are able to do anything which we want to do for the community. Then second principle is that we must be an effective team member in the community health nursing or community health practice, because it is not only with nurses you are working, it is other health and health allied professionals with whom you are working, like medical people are there, sanitation people are there, statisticians are there, with whom you are interacting. It may be school teachers, it may be other occupational health people with whom you are interacting. So you should be an effective team member. The community health nurse also should be responsible to the agency with which she is working, because whatever are the targets, whatever are the goals of that particular organization or agency with whom you are. Like for example, our government has a target to eradicate polio. So Pulse Polio is one program which is implemented through community health areas or other areas. So as a community health nurse, my target should be to see that there are no cases, or whatever are the approaches which are used, I am also participating in that approach. Then community health nurse should be also available to the people as and when possible, not keeping a barrier of age, sex or capability to pay or socio-economic status. So as a community health nurse, we should keep in mind that we are not bringing any differences to whom the services should be given. Then community health nurse should be non-secretarial and should not be a part of any political party, or should not be believing in one type of religion. Like for example, if we are biased, or if we say that this party is good, that party is not good, and we may come into those discussions instead of working with the community. And sometimes there may be difference of opinion which may come up because of being a one-sided political or religious group. Then community health nurse should also not accept any type of bribes, gifts, or any favoritism from any type of community members, because that will also not show any professional ethics which we should practice, or professionalism in nursing. So it is better that we keep ourselves to the professional practice itself. Not we are a member of the community, but we should not get into such practices where people will criticize, or people will say that this person is only interested in getting some returns from the community itself. Then health services should be based on the needs of the community, or any health programs which are planned for the community should be based on the health needs of the community. Then services offered should be the realistic in terms of available resources or available manpower in the sometimes we plan, but we are not able to deliver those services because resources are limited or manpower is limited. Like for example, we say every antenatal mothers should be visited every month, but then we have only one PHN or one lady health visitor in the center, so we may not be able to give that desired services. So our goals should be somewhere realistic type of goals in the community health services. Then health education should be integral part of community health services. Giving of or delivery of services, comprehensive services is our goal, but health education plays a very important role. Like Mrs. Patni was emphasizing that they should become self-reliant. So to make them self-reliant, we have to educate people so that there is a change in behavior and they can have some healthy behaviors and health practices which are leading them to positive health. Then community health nursing should be a continuous service. It is not that today we have gone to the community, done the home visiting or done the clinic and it stops there. No, it is a beginning step. If a antenatal mother has been taken care of in the clinic, maybe the follow-up visit has to be there in the family or in the setting where she is available. So community health nursing services are continuous services. Then adequate reports and records should be maintained so that the follow-up care is there and final evaluation of the care also can be done. Then community health nurse needs to be well versed and well qualified with the recent advancement and changes in the community.
I think that's quite in detail which Mrs. Mehta was talking about, the principles which you need to keep in mind. In this program, you have definitely got an idea about what is community health nursing and what is community health. Also, what are some of the changing trends in community health where the community health nurse has to play an important role, and what are the specific characteristics related to community health nursing. I think it is very descriptive about, the discussion was very descriptive about the community health nursing framework which leads you to the nursing process, how to do the community diagnosis, identify the community needs and plan the actions and evaluate. Wrapping it up with the principles of community health nursing would have given you an idea that how as a community health nurse you have got major roles to play. So with this we wind up for this session. We'll be back at 3:30, but may I request all the regional centers to kindly let us know how many students are attending today's teleconference. We'll be back at 3:30 and discuss about the nursing education and research for post-basic BSc nursing students. Thank you so much. Thank you very much.
You.